Hello, students. Welcome you all. Have you ever wondered how a government knows how many schools to build, where to place a hospital, or if a disease is spreading? It all starts with a simple personal moment, that is, a birth, a marriage, or a death. So, welcome to the world of statistics. At its core, vital statistics is the science of recording of the life events of a population. It's not just numbers on a spreadsheet, it's a systematic record of the human story from birth to death. These starts these statistics provide a continuous qualitative picture of a community's health and development. So, why should we care about these vital statistics? Because they help plan for the future, they improve community health by tracking mortality rates, they provide legal documentation for the birth and death certificates, and without them we will be navigating public health in the dark. So, what makes up this vital events? It is more than just birth and death. Okay, it includes natality means birth rate, mortality, that is death rate, nuptiality, which means marriage and divorce rate, and migration, that means people moving in and out of an area. So where do these numbers come from? So mainly this number will come from CRS, that is called as Civil Registration System. It is a compulsory registration of events as they happen. Other sources include the census and sample surveys like the National Family Health Surveys. And vital statistics are truly pulse of a nation. Okay, they ensure that individuals are recognized by the law and that communities can play for a healthier and more stable future. Objectives of this video, will learn about the introduction, definition, purposes, importance, indicators of maternal and child health, and what are all the things under vital statistics, namely the birth rate, maternal mortality rate, maternal morbidity rate, perinatal mortality, neonatal mortality rate, infant mortality rate, and fertility rate. And at last, will be seeing about the role of nurse in vital statistics. We'll see about the introduction. Vital statistics is an essential part of public health. Similar to how if you go to a clinical settings, the vital signs are important, right? That is the temperature, pulse, respiration, and blood pressure. Same way, these vital statistics are essential part of the public health. Vital statistics help us to understand the health status of a whole population. These statistics include data on births, deaths, marriages, diseases. Okay. Vital events refer to an important life event such as birth, death, and illness that affects population health. Vital statistics involve the collection, analysis, and interpretation of these events. This process is like maintaining a health record for the community. Okay. You would have seen the health record for an individual, but this vital statistics basically means maintaining the health record for a whole community. Without proper records, it would be difficult to identify health problems or plan any services for that particular community. For example, during the diseases outbreaks such as COVID-19 in the recent years, vital statistics helped track infections and death rates and guide, and it helps in guiding the uh, control measures, okay, to employ the control measures for the COVID-19. Definition: vital statistics are defined as the numerical records of events like birth, death, and sickness, and it is used to study the health and growth of a community. These numbers are not just figures, they tell a story about a population. For example, a sudden increase in deaths may indicate an epidemic, while a high birth rate may indicate population growth. Thus, vital statistics acts like a mirror reflecting the health condition of a society. Purposes: the main purpose of vital statistics is to assess community health, identify health problem, and evaluate health services. It helps in decision making, similar to how lab reports helps in guiding the treatment for a particular individual in clinical practice. For example, if the data shows high maternal deaths, the government can introduce better maternal health programs. It also helps in developing health policies and laws at local and national level, and it ensures better healthcare delivery. Importance. Vital statistics are important because they help evaluate national health programs and plan disease prevention strategies and understand social and economic development. For instance, improved infant mortality rate indicate better healthcare services. They also support research by providing reliable data. In 2026, with the increasing use of digital health records, accurate data collection has become even more important for evidence-based practice. So vital statistics are very important when we look in the perspective of evidence-based care, in the perspective of research, and also in this perspective of understanding the social and economical development of a community. We'll move on to the next topic, that is indicators for maternal and child health. Maternal and child health indicators are sensitive measures of a country's health status. They reflect the quality of healthcare services, nutrition, and education. Just like monitoring a newborn closely helps detect problems early, these indicators help detect issues in community health. Common indicators include birth rate, maternal mortality rate, infant mortality rate, and fertility rate. Okay. Next, we'll move on to the birth rate. Birth rate is the number of live births per thousand population in a year. It indicates population growth. A high birth rate may suggest limited access to family planning, while a low birth rate may indicate better awareness and healthcare services. For example, in India's birth rate has been gradually declining due to increased education and contraceptive use. In India, the birth rate has declined significantly from about 36 per thousand in 1971 to around 18 per thousand population in recent years. So they are reflecting better family planning and education. Next, we'll move on to the maternal mortality rate. Maternal mortality rate refers to the death of a woman during pregnancy or within 42 days after delivery. It reflects the quality of maternal healthcare services. Common causes include hemorrhage, eclampsia, infection. Globally, around 287,000 maternal deaths occur annually, most of which are preventable. This shows the importance of antenatal care and skilled birth attendant. Maternal mortality is a key indicator for maternal health services. In India, the maternal mortality rate has reduced to around 88 to 97 per 100,000 live births in 20 to 23 to 20 to 25 estimates. So it shows a significant improvement, but still it requires attention to reach the SDG targets. We'll move on to the causes of maternal mortality rates. Maternal mortality can be due to direct causes like hemorrhage, eclampsia, indirect causes like anemia, heart disease, and non-obstetric causes like infection or accidents. Think of pregnancy as a stress test for the body. Any existing condition can worsen during this time. Okay, so proper screening and timely treatment can prevent most of these deaths. We'll move on to the maternal morbidity rate. Maternal morbidity refers to the complications during pregnancy, childbirth, or postpartum period. Unlike mortality, morbidity affects the quality of life. It can be temporary, like hemorrhage, or permanent, like fistula. It is often called hidden burden because it affects many women but receives less attention than mortality. The morbidity rate remains high due to complications like anemia and infections. Even when the women survive, many suffer long-term health problems, emphasizing the need for comprehensive maternal care services. Causes of maternal morbidity. Causes include direct complications like obstructed labor and eclampsia, and indirect causes like infection and anemia. These conditions can lead to long-term health issues. For example, untreated obstructed labor can result in uterine rupture or fistula, severely affecting a woman's life. We'll move on to the preventive and social measures. Prevention includes early pregnancy registration, regular antenatal checkups, institutional delivery, and proper nutrition. These measures act like preventive care in nursing, and it will stop the complications before they occur. For example, iron supplementation can prevent anemia, which is a major cause of maternal complications during the postnatal period. We will move on to the perinatal mortality rate. Perinatal mortality rate includes deaths from late pregnancy to the first week of life. It reflects both the maternal and newborn care. A high rate indicates poor health services. For example, lack of skilled birth attendant can increase birth related complications. Perinatal mortality rate reflects on both maternal and newborn the quality of care. The reduction in this rate indicates improved antenatal and intranatal services in India. Causes of perinatal mortality rate. Causes include maternal diseases, birth injuries, prematurity, and infections. These can occur before, during, or after birth. For instance, poor maternal nutrition can lead to low birth weight, and it increases the risk of neonatal death. Prevention of perinatal mortality rate. Prevention includes proper antenatal care, early detection of high risk pregnancies, and neonatal care services. Education of mother is also important. Think of it as a continuum of care from pregnancy to newborn period, ensuring survival at every stage. So, survival at every stage is very important in order to prevent the perinatal mortality rate. We'll move on to the neonatal mortality rate. Neonatal mortality rate refers to the deaths within the first 28 days of life. This is the most vulnerable period for a newborn. Common causes include low birth weight and infections. In India, neonatal deaths contribute significantly to infant mortality and highlighting the need for improved newborn care. Neonatal mortality rate in India is around 19 per thousand live births according to recent estimates, showing that steady decline over time due to improved newborn care. Causes of neonatal mortality rate. Major causes include birth asphyxia, infections, and congenital anomalies. These conditions require immediate medical attention. For example, delayed resuscitation at birth can lead to fatal outcomes for the neonate. Infant mortality rate. Infant mortality rate measures deaths within the first year of life. It is the key indicator of a country's development. A lower rate indicates better healthcare, nutrition, and sanitation. Infant mortality rate is a key development indicator. In India, IMR has reduced to about 25 per thousand live births according to 23 to 25 estimates, showing a significant improvement. Causes of infant mortality rate. Causes include low birth weight, infections, and congenital anomalies. Poor sanitation and lack of immunization also contributes to this IMR. For example, diarrheal diseases remain a common cause in developing regions. Preventive measures. Preventive measures of infant mortality includes breastfeeding, immunization,
proper nutrition, and sanitation. These are simple but effective interventions. For example, exclusive breastfeeding for 6 months can significantly reduce infant death. We'll move on to the fertility rate. Fertility rate measures the reproductive capacity of a woman. It helps understand population trends. A declined fertility rate indicates better education and access to contraception. In India, the total fertility rate is about 1.9, which is below the replacement level, that is 2.1. It indicates the population stabilization in India. Total fertility rate. Total fertility rate represents the average number of children that would be born per woman if all the women were to live till the end of their childbearing year and they give birth to the children according to a given fertility rate at each group. So it is the average number of children that would be born to a woman. It's called the total fertility rate. We also have another term called a general fertility rate, where it measures the births among the women of reproductive age, while total fertility rate shows the average number of children per woman. In India, the total fertility rate has reached near replacement level, indicating population stabilization. Role of nurse in vital statistics. Nurses play a key role in collecting, recording, and reporting data. They ensure accuracy, which is crucial for planning healthcare services. Just like accurate charting is important in a patient care, accurate data is essential for public health decision. Nurses also educate the community about the importance of registration and they participate in the surveys. So in conclusion, vital statistics transform numbers into meaningful information that guides the healthcare planning and improves population health. As future nurses, understanding and using this data effectively will help you contribute to better healthcare outcomes at both individual and at community levels. Thank you.